Hello everybody, Luke Gordon here, physical therapist, and today's topic is physical therapy versus massage therapy. What's the difference? Is there a difference? Who are these people? How are they going to help me? What's the best choice for my pain relief? So that's what we're going to talk about today. Going to talk about some of the differences between the two fields. I've got another video that talked about the difference between PT and chiropractic. I'll pop that up somehow towards the end of this video. But again, get a lot of questions or just misconceptions about, well, should you see you got neck pain or back pain or shoulder pain, all that tension. Should I see a physical therapist or should I see a massage therapist? And then I hear people say about PT, PTs will be up on their little high horses and say, well, I'm not a massage therapist, so I won't do this or that. So before I dive into like the really basic differences, what I want to preface this video with is that within PTs, there's a huge range of PTs. If you've watched some of my videos, you've heard me kind of yammer on and get real worked up about PTs that really just don't like to put their hands on you, and how I think that's really an underservice to their clients, especially clients who are in pain. Now, as a PT, not all of our clients are coming here for pain. A lot of our clients are coming here for balance and mobility and things like that, but the average client has pain somewhere, and you would do them a huge service if you took it away from them, which usually involves using your hands. Now, if you're a massage therapist, that's kind of your whole life. You use your hands. That's what people are coming to you for. That's what they're expecting. Now, you might use your hands, or you might use a certain massage tool, different techniques. You might use an elbow. I know massage therapists that use their feet. So again, before we go into like the key differences that are kind of across the board in my mind, keep in mind that within PTs, there are PTs who are mostly just exercise-based PTs. They'll never put their hands on you no matter what. And there are PTs that are more like how I think is that the best thing we can do for a lot of our clients is put our hands on them and do manual techniques, hands-on techniques, and that's where we might really overlap with a massage therapist. So let's dive into some of these details then. Between good PTs, bad PTs, obviously with massage therapists there's going to be some that are better, some that are worse, some that know really cool techniques, some that know things like myofascial release, different types of friction massage, instrument assisted massage with like scraping tools, stuff like that. So between PTs and massage therapists, there's going to be different techniques. We can pretty much do any technique. The only thing a massage therapist couldn't do that a PT could do would be something more along the lines of like joint mobilizations. So essentially massage therapists are kind of limited. They're in a little box in terms of using their hands to treat muscles and soft tissue. Whereas a PT, we're almost a little bit closer to a chiropractor in that we can mobilize your joints. In certain states, it's a state-by-state thing for PTs. We can manipulate your joints. In Washington, where I live, we're not allowed to do that. But I believe over in Idaho you can. Lots of PT friends I have manipulate joints more like a chiropractor. So again, between those two, a PT that uses their hands is going to be more inclined or more able to help with your joints as well as the soft tissue. But within the soft tissue, there's a ton of overlap between PTs and massage therapists, just depending on what they like. You take like basic soft tissue massage versus a deep tissue massage, and anywhere in between. PTs can do that. Massage therapists can do that. So there's a lot of overlap there. Myofascial release type techniques, we can both do it. Scraping, cupping, different instrument type assisted techniques, we can both do it. So there's a lot of overlap there with techniques. So it just comes down to which techniques do they use and which techniques do you like better as a client, and hopefully figuring that out with both your therapists. The other big difference you're going to see between PTs and massage therapists, of course, is the use of exercises. So a lot of massage therapists don't ever get into like the realm of giving you exercises. I'm not positive with their like practice act if they're even allowed to do that, although some will. I don't think it's rocket science to give people some basic exercises, but PTs, of course, that's what we're trained to do, heavily trained in exercise-based techniques. Again, from my approach, how we should do that is focus largely on home exercises for somebody, and then spend a good chunk of our time with you working with our hands to do things that you can't do. Now again, that depends on the client, but if we're treating a client that could go either way, PT or massage, and we're treating like a neck pain, again, I would favor with our PTs at the clinic mostly hands-on techniques, stretching, mobilizing, deep tissue, soft tissue, again, any of those techniques I mentioned, cupping, scraping, stuff like that. The other difference you might see is taping techniques. So as PTs, there's a lot of taping techniques we use. Kinesio tape is kind of the most popular one right now. I believe some massage therapists can do that, but again, I don't think a lot of them do actually use those types of techniques. So again, another key difference is exercise. The biggest difference, in my opinion, is that typically when you're working with a PT, what you're going to get, especially the way that we do it here at my clinic, is you're going to get an assessment. So if you come in with neck pain and headaches and maybe an underlying shoulder issue, the first thing we're going to do before we do any type of treatment is we are going to assess your problem. We are going to dive in and look at all these muscles, all these joints, underlying history, rotator cuff, all these things, strength, posture, all these things that could be causing your pain, and we're going to figure out why you have the pain. I refer to that as the root cause. We're going to figure out the root cause of your pain before we start jumping into treatment. Then, after we know what's causing your problem and we know your goal in terms of where you'd like to be, then we're going to design a plan that takes you from where you are to where you want to be. And that's what we're going to focus on, is the overall result of your period of care, which might be 4 to 6 weeks, come in twice a week, 3 times a week, whatever it is. What we're talking about, though, is a plan that includes all of these treatments to get you from where you are to where you want to be. In the PT world, we call that a plan of care or a POC. So that's the biggest difference, that you're going to get an assessment. We're going to really strive to make sure you understand why you're hurting, and we're going to help you get rid of the pain, but also help you keep it from coming back. So if, again, in our example, if there's an underlying postural issue, an underlying strength issue, an underlying rotator cuff issue, not only are we going to take all this pain away for you if we do our jobs correctly, but we're also going to say, hey, when you get to the end of your plan of care, towards the second half especially, to keep this pain from coming back, here's what you need to do. We need to change your posture with this. We need to strengthen these muscles, back by your shoulder blades. We need to get on top of this rotator cuff issue. And then when you reach your goal, you've got a really good chance of staying there and not just having to come back, twice a month or whatever it is. So that's our ultimate goal, especially when we're working, kind of in an insurance-based world where we have an episode of care. So we tend to be more like, here's an episode of care. Let's see where you are. Let's see where you want to go. Let's get you there, and let's try to help you stay there. So contrast that with a massage therapist, and typically they're not doing an assessment, at least not the same way that we're doing it. What they're doing is, if you come in and you say, I have neck pain and shoulder pain and headaches, is they're treating the pain. And that's what they're doing. They do a very good job at treating pain, in my opinion, but they're not necessarily taking you any farther than pain relief. And to me, and not to be mean to massage therapists, and maybe there's some watching that disagree, to me, the massage therapist isn't really ever selling you an outcome or promising you an outcome. They're promising you a really good massage. But then, where does that get you? I mean, do you need to do 2 massages a week for 6 weeks to reach your goals? Or, in my experience, do you just come back for a massage when you want another massage? And that's where I see it. So they're not getting down to that deeper level usually, to the root cause. They're not helping you understand it. And they're not usually helping you get to a specific place that you can stay there yourself. That's the place you want to stay yourself with, again, the corrective exercises, this, that, and the other thing. So again, that's kind of more of a generality. Maybe it's unfair to some extent, but I think that's the biggest difference, is that we're trying to help you achieve something that's tangible, keep you there, and then of course if you need care in the future, you can certainly come back. So that's, again, I think the biggest difference. One last thing I want to mention before I go, I know it's a long video, but hopefully it's been useful so far, is that in certain situations, it's just like PTs and chiropractors. PTs and massage therapists can really work well together, especially if the PT is doing more of the assessment side, and they're doing some of the hands-on side, and they're doing more of the exercise side, and then you've got this lovely massage once or twice a week that's really helping you with the pain relief. So especially if you've been injured at work, something that's really painful, car accident, things like that, we can really work well together, just like how PTs and chiropractors can work well together. So keep that in mind too. We're not enemies, we're not against each other. I think getting a massage can be more just ongoing health and maintenance too, which PT isn't usually maintenance. So that's another difference to kind of keep in mind. But having a good massage learning with PT can be really valuable. So please don't think that we're not friends. Hopefully I haven't offended too many massage therapists if you're watching the video. I do value what you guys do. You guys do a great job, and I think we work well together. I mentioned earlier in the video that we also work well with chiropractors, or that I talk about the differences, so I'm going to link that video, I think, to the end of this one, so it should pop up on one of these little fancy boxes that YouTube allows me to do. So that should be right there. And any questions, I'd love to hear it. Leave me a comment. If you like the video, you want to hear more, please like it, leave me a comment, and please subscribe to the channel so I can, you get notified with more videos. So that's it for today. I hope it helped clarify some things, And any questions, reach out to me, leave me a comment. That would be lovely. Have a great day.